When speaking to chronic headache and migraine sufferers, they often feel like they've done everything under the sun to deal with their chronic headaches and migraines, but yet they're still left suffering. So why is this happening and what can we do about it? Hi, I'm Dr. Beth, Osteopath here at Melbourne Headache Solutions. So often when you've been suffering from headaches and migraines for a really long time, you feel like you've done absolutely everything under the sun to treat your headaches and migraines. And you've taken medication after medication for your headaches and migraines. And these often include things like Panadol and Nurofen, and then you go on to things like your Panadine Fortes or your Max Salts, your Migraines and those sorts of things. And then other times people go on to things like preventative medications like Topamax and migraine and those sorts of medications. And when you've been trying these medications after medications after medications, it really does feel like you've tried everything under the sun. Unfortunately, when it comes time for taking medications for headaches and migraines, a lot of the time they're not actually treating the cause of headaches and migraines. And so you're still left with the problem that's causing your headaches or your migraines. And so the pain keeps coming back again and again and again and again. When it comes time for other approaches for treating headaches and migraines, often the approach is more aimed at targeting the symptoms rather than actually treating the cause again. And so you might get symptomatic relief of your headaches or your migraines like medication, but again, it doesn't actually do anything to help prevent the next headache or the next migraine from coming on. And so then you're still left with future attacks coming on. And so what we need to do is we need to actually address the underlying problem of headaches and migraines so that we can try to aim to prevent future attacks from occurring, to actually make significant changes to your headaches and migraines, because no one should be left suffering with headaches and migraines. They're an unfair condition. They rob us of so much that it's just not fair, and no one should have to have them. So with headaches and migraines, unfortunately, they are not simple conditions. They are quite complex. So like people, they are quite complex. So for some people, you just treat one thing and they disappear, which is fabulous. But for a lot of people, it's quite a multifactorial approach. So we do know that for a lot of people, up to 80% of people, then it is a strong neck component. The top 3 joints in the neck are a really strong component in regards to their headaches and migraines. But for a lot of people, then they've got other factors that are contributing to their headaches and migraines as well, whether that be hormones, stress, anxiety, diet and gut health, supplementation, jaw problems, sleep problems, posture, and these sorts of things as well. So if you are just looking at one aspect of a person and just taking that in isolation, people aren't going to get the best results possible. Whereas if you look at the person as a whole and address these factors, then you're going to get the fastest results possible. And so that's what we're all about. That's what we're interested in with our patients, is getting the fastest results possible so that we can help people get rid of their long-term headaches and migraines. And so basically, with all of these factors that I mentioned in terms of the neck, diet, stress, supplementation, hormones, and these sorts of things, then basically they lead to the body and a part of your brain becoming sensitized. And this is known as brainstem sensitization. And that is what we know is the underlying disorder in a migraine. And so when we address this, when we target this, which is known to be the cause of migraines, then that's how we help to prevent further attacks. We address the cause of the migraines, and that's how we make these significant changes. So that's what we want to do. We don't just want to treat the symptoms of a migraine or a chronic headache, or else we know that we're going to get continual attacks happening. We want to address the cause so that we can make those long-term changes. So what we do have is up in the description above is a questionnaire that's been designed. So fill it out if you're interested in finding out the cause of your headaches and migraines. Fill it out. It doesn't take very long. You get a detailed description as to what might be contributing or causing your headaches or migraines. And if you've got any questions or queries about headaches and migraines, please drop it below. because, as I said, we're really interested in helping people get to the bottom of their headaches and migraines and making these long-term changes, because I know that so many people have felt like they've tried things again and again and again and again and they just haven't worked, and you don't want to be spending the next 5, 10, 15, 20 plus years feeling like you're just trying things again and again and going around in circles. As I said, headaches and migraines are unfair. They take away so much of your life. You shouldn't have to be suffering with them. So if you've got any questions or queries about them, we want to help make sure that it doesn't take away any more of your life. So drop it below. I hope you found this helpful. And as I said, I look forward to answering any questions that you might have. Thanks guys. I'll catch you next time.